Welcome back to It's Your Case, presented by VetCT.com. I'm Heather Chalmers, your radiologist on demand for this week. Today's example is a 15-year-old female spayed cat with chronic right front lameness. Look at this elbow. Let's start with the lateral view. And now, the CC view. Many of you will have noticed, especially on this view, that there's an area here that's abnormal compared to what we expect for the feline elbow. Let's practice compiling our thoughts by completing this sentence. At the medial aspect of the right elbow, I see. For me, I would probably describe this as a large or even very large, smoothly margined, calcified body. I would say that it's centered here at the medial epicondyle of the humerus, that there's an adjacent sort of bulge that it creates, and that there's, on the other view, the impression of overall increased opacity in this region. This increased opacity, which you might have noticed when we first started looking at the lateral view, is called summation. Summation happens when two structures are superimposed in plane with the X-ray beam. So their opacity that results is essentially a combination of both structures. Negative summation is when gas or something more lucent is superimposed. In this case, it's a positive summation. You can see that when the X-ray beam goes through this elbow in a lateral view, you have a generalized increased opacity resulting from more mineral opaque structures being penetrated by the X-ray beam. So here we have a positive summation as a general finding on the lateral view, which might tip us off to look at the orthogonal view, but this is an example of a lesion that's much better assessed here on the CC. So, what would cause a calcified body that's this large at the medial aspect of the feline elbow? In general, when we find joint-related calcified bodies, we think of various differentials. But in this instance, it's a specific condition that's been recognized in cats and termed medial epicondylitis. Although research has shown it's not particularly inflammatory, so the itis part of medial epicondylitis maybe is a little misleading. This condition has been studied grossly and histologically. Mineral has been associated with the origin of the humeral head of the flexor carpi ulnaris muscle. This takes its origin here at the medial epicondyle of the humerus. The mineral, especially as it becomes very large, as in this 16-year-old cat, can impinge on the ulnar nerve as well as causing pain related to tendinosis in the adjacent flexor carpi ulnaris tendon. This finding has been reported in up to 10% of cats and is not always associated with lameness. Going back to the orthogonal view, the other finding that I see in this case is a small amount of periarticular new bone formation consistent with arthritis. The elbow joint, where I like to see that when I do my C for cartilage, I like to see that smooth kind of crescent-shaped radiolucency. You can see that the joint space width is non-uniform and a little bit irregular. So lots of degenerative joint disease to go along with medial epicondylitis in this case. Cats are special to me, so I hope you've enjoyed learning about a couple radiographic features of medial epicondylitis and last week, proximal femoral pathology, which are specific orthopedic conditions in cats. Be sure to review the full report associated with this case, and maybe tell me the name of your adopted cat or kitten. Thanks for listening, and remember, it's your case, so please post your questions on social media.